Hey guys, welcome to Nightmare Medicos. In this channel, we basically will cover all the topics of medical science till the MBBS level. So, we're going to start with a very basic topic which is required and very important. The topic is certain important terms in anatomy. So, these terms are very important and they are going to be frequently used in the upcoming lectures. So, first of all, what is the anatomical position? See, I'm a very simple person. I talk in very simple words. If somebody asks me what is a anatomical position, I'll say just stand erect and turn your palms forward. That's it. That's the anatomical position. See, look at this lady. This lady is having her palms pointed forward, and this is basically a anatomical position. So you may ask me that what is the significance of anatomical position? So I'll say that it's very simple. See, in case of anatomy, we are going to discuss and we have to locate and we have to describe the position of various muscles, nerves, arteries, and all those things. So for that, we need to have a standard position, standard reference position, right? So that standard reference position defined by scientists is this position, that is the anatomical position. So that's nothing, just stand erect, your palm should point forward, your feet should point forward. That's it, that's the anatomical position. Next comes two terms, that is the supine and prone position. What is a supine position? Supine position is basically a person lying on back. That's a very simple thing. Just a person lying on back, that is a supine position. And the prone position is just opposite to it. A person lying on chest, that is a prone position. But the thing is that people get confused that which one is a supine position and which one is a prone position. See, we know that spine is at the back. Spine is at the back. So lying on the back should be called as a supine position. This is just a simple trick so that you never get confused. Next thing is the sagittal and coronal plane. What is a sagittal plane? A sagittal plane is basically a plane which divides the body into right and left part. It is not necessary that a sagittal plane should divide the body into equal symmetrical right and left part. It can also divide the body into unequal parts. That's not a big deal. But the thing is that a sagittal plane divides the body into right and left part. I hope the diagram clarifies the thing for you and it's very clear to you what is a sagittal plane. Now let's come to a coronal plane. A coronal plane is going to basically divide a human body into a frontal part and a back part. If I talk in scientific terms, then a coronal plane is going to divide the body into an anterior and a posterior part. And a coronal plane is always perpendicular to the sagittal plane. So you can see the diagram of these two. Then this is very simple, not a big deal. But again, the problem is that you forget that which one is the sagittal plane and which one is the coronal plane. So have you ever seen a queen wearing a crown? Crown is always from one ear to the other ear. So whenever a plane which passes through the ears, then that is going to be a coronal plane. Just remember the example of crown. Then if any confusion arises, then you can clarify it. It's just again another trick from my side. Then I have two terms, that is the medial and lateral. These two are very simple terms. Medial means towards the midline, right? And lateral means away from the midline. These two are very relative terms. They are not absolute terms. Medial means towards the midline and lateral means away from the midline. But these two terms are going to be frequently asked and used in the upcoming lectures for anatomy, for describing the position of various muscles and nerves. So these two terms are also important. Then comes what is a flexion and what is a extension. So there are various definitions of flexion and extension. First of all, what is a flexion? Flexion is basically a bending. Flexion is basically a bending towards the anterior. Bending anteriorly is called a flexion, whereas extension is bending posteriorly. However, there is an exception of knee joint, that is a separate thing. Anyways, but I'm a simple person. I'm going to define these two terms, the flexion and extension, in a very simple way. See, flexion is always going to decrease the angle. Generally, flexion decreases the angle, and extension is going to increase the angle. Can you see that? The first diagram is of flexion, where we are just bending the wrist and the angle is basically decreasing. So this is a flexion. And extension, here the angle is increasing, so that is an extension. I hope it's very clear to you all. Now let's move into the next slide. See, I have seen even very high-fi students, the 5th year students, getting confused in which one is a radius and which one is a ulna. Sometimes people get heavily confused in this. Yes, so I give you a very simple trick to remember that which one is the ulna bone and which one is the radius bone. Just have a look at this diagram. You see that the radius and ulna are marked, and everyone knows, even a 12th or 11th standard student knows that one of them is a radii and the other one is ulna. But people, even high-fi people, sometimes gets confused that which one is a radii and which one is ulna. So let me give you a very clear idea, a very good trick for that. See, ulna is a small name, right? Radius is a bigger name. So ulna is always going to be towards the smaller finger, that is the little finger, and radius is going to be towards the thumb. The bone that is towards the little finger, since ulna is a small word, right? So towards the little finger, that's going to be a ulna, and other one is going to be the radius. So I hope that this trick is very useful for you, and you are never going to get confused that which one is ulna and which one is a radius. So that's it for the video. Wait, there is something more I should say. I have already defined that what is a supine position and what is a prone position, right? This is the supine position and this is the prone position. I have defined that. There are also two terms, that is supination and pronation. I'm showing you. So see here you see supination and pronation, right? Can you see them? Remember that supination and pronation are completely different words. They are no way related to the supine position and the prone position. Often students get confused among these four terms, that is the supine and supination and prone and pronation. Supine is no way related to supination and prone is no way related to pronation. These two are different things that I'm going to discuss in the further videos. Anyways, for now I'm going to say that a pronation is basically pronation and supination are basically special movement of the forearm, where we just twist the forearm. So twisting it such that the palm facing the midline, that is a pronation, and twisting the forearm in other way, that is a supination. Anyways, I'm going to tell about these two things in upcoming videos, not a big deal. So for today, I hope you have learned various words. Let me give you a quick revision. First of all, I've said what is the anatomical position. Anatomical position is nothing. You have to just stand erect and palm should face forward. That's it. Then supine and prone. Since spine is at the back, so supine position should lie at back, and the other opposite one is the prone position. Then sagittal and coronal plane. I have given you the example of crown that goes from ear to ear, right? So ear to ear plane is going to be called as the coronal plane, and the other one is going to be called as the sagittal plane. Very simple. Then we have medial and lateral. These are relative terms. Medial means towards the midline and lateral means away from the midline. And then flexion and extension, I have defined them. Flexion is bending anteriorly, and extension is bending posteriorly, that is basically straightening. Anyways, in case of flexion the angle is going to decrease, and in case of extension the angle is going to increase. And I have also given a clear idea about radius and ulna. Since ulna is small, so ulna is always near to the little finger. Okay, ulna word is very small in comparison to radius, so ulna is going to be towards the little finger. I hope you will never get confused again. I hope you liked the video, and keep visiting Nightmare Medicos. Like and subscribe my videos, and wait for the upcoming videos. Thank you very much.